Good morning, everyone. My name is Chris Palmer. I'm a psychiatrist here at McLean Hospital. I'm also the director for the Department of Postgraduate and Continuing Education and also the director for this webinar series, the Borderline Personality Disorder Family and Consumer Education Initiative. Couple of things. Today's webinar is a follow-up webinar on self-injury. So Dr. Michael Hollander already presented an entire presentation and took some questions on self-injury, and that is archived on our website. So if you have not viewed that video, I would encourage you to start there, especially if you are viewing this in an archived version. And I'm hoping that everybody who's joined us this morning has already watched that video because that sets the stage with some basic information. And today's webinar is going to give us an opportunity to do a more in-depth exploration of specific questions and specific cases and how to apply the information in the material. So Dr. Hollander is the Director of Training and a Senior Consultant at the 3 East program here at McLean Hospital. For those of you who don't know, 3 East program is a woman's program for young women and adolescents who have borderline personality disorder or emerging borderline personality disorder. And as you probably understand, self-injury can be a common problem seen on that unit. He's also an assistant professor of psychology in the Department of Psychiatry at Harvard Medical School. Before we get started, a few logistical announcements. So one is that today's webinar, again, is intended to be very interactive. We want questions. We want clinical cases. We want the things that you're struggling with. Some of you have already submitted questions and cases. So we have 11 clinical cases and questions that we're going to try to get through. But for those of you joining us, if you didn't submit a question, please do so even right now. In the Q&A box in your lower right-hand screen, you can type in questions. If you want to describe a situation that you're experiencing and you're not sure how to deal with it or you're not sure what to make of it, feel free to do that if you have a simple question. And we'll get through as many of those as we can. All of your microphones have been muted and other participants cannot see your name or email address or anything about you. And we do that to ensure everyone's confidentiality. I want to put a plug in that if you are on Twitter, you might want to follow us on Twitter and you'll get updates about upcoming webinars. You'll also get links to archived webinars. For those of you who have not visited our website, in the lower left-hand corner of your screen, you'll see several web links. That first one is a link to our website, and that includes all of the archived webinars that we've done so far, and we'll continue to add to that library of information. For those of you who are interested in our next webinar, it's actually next week at 4 o'clock Eastern Time, and it is going to be another follow-up presentation by Dr. Karen Adler, who spoke about how to manage conflict and how to communicate more effectively with people with borderline personality disorder. And the title of her webinar is How to Speak Borderline, not that borderline is really a language unto itself, but sometimes it feels that way. And we are going to be doing a lot of role plays and answering questions, but role plays will be part of that. And so we encourage you to join us for that webinar, and you can register with that web link. And then the next 3 links are links to other educational resources on borderline personality disorder. Certainly if you're looking for a clinician in your area, some of those links can be valuable. And finally, I want to just acknowledge that this entire webinar series is brought about by philanthropy. It was a generous gift from a family who's been affected by borderline personality disorder, and they wanted to get more information out to the public, especially more information for families. And if you're in a position to be able to help support these webinars, there's a link there that will allow you to give a gift, large or small, to hopefully be able to continue these webinars for a longer period of time. And so with that, I'm going to welcome to the webcam Dr. Michael Hollander.
Good morning, folks. Just to add on a little bit of a plug, we, 3 East, has just opened up a residential program for boys and young men. We just opened it up actually last week, and so we will be expanding our treatment to boys and young men. All right, so let's get right to the questions.
Great. So Dr. Hollander, our first question comes from somebody who says, my daughter cuts infrequently, but when she does cut, how should I respond? I don't want to say anything that might positively reinforce this behavior, such as giving her and her injuries a lot of attention, nor do I want to scold or shame her.
All right. Well, this is actually quite a good question because unwittingly, people close to self-injures can reinforce the very behavior that we're all trying to stop. So I think the best thing here is simply to speak to your daughter's suffering and to simply acknowledge that you know that when she does self-injure, it's a sign that she's suffering and that you hope and have confidence in her that she will be able to get the kind of help and support that she needs to diminish her suffering. So that's what I would do. I would not belabor it much. I think one of the things that certainly for parents of adolescents that we do is sometimes we try to say too much. So I'd keep this one short and sweet and just speak directly to your daughter's suffering.
Can I ask you to put that in concrete terms and maybe do a role play? So let me say I'm the daughter. Mm-hmm. You're at home doing your thing, mm-hmm. and I'm in my bedroom, and I've just cut myself, yeah. And you knock on the door, and I say go away, and that's a warning sign to you.
Yeah.
And the door's unlocked, and you open the door, and you see me sitting there, and I've just cut.
All right. So I think what I would say would be simply, oh, I know that you must be really troubled right now. I'm sorry that you weren't able to ask for help in the moment, but I have confidence that you'll be able to figure this out. Of course, you do want to just get enough information to make sure that the self-injury doesn't need medical attention. That would be the only thing. But that needs to also be done, which is a very difficult thing for parents to do in as neutral a way as possible.
Okay. So something along the line of, do you think you need medical help for your injuries? Are you able to stop the bleeding?
Yeah.
Can you put some Band-Aids and some, antiseptic gauze or something, or antiseptic ointment on that?
Yep.
And then leave it at that?
I would leave it at that.
And then do you discuss it again after that?
That really depends on your current relationship with your kid. If you have a channel where you think that you're going to get some traction in a discussion, yeah, then I'd bring it up again. If, as is often the case with adolescents, you're only going to make the situation worse by pursuing this, then I would leave it alone. Now, that raises the issue about how parents have to tolerate their own distress in these situations. So while I think I may be coming across as in a casual and maybe even cavalier kind of way, the stress and distress that parents feel when their kids are self-injuring and the helplessness that they feel in the face of this worrisome behavior really does take a lot of skillful behavior.
Do you have any thoughts about whether the parent should contact the child's treater, the therapist or psychiatrist, and leave a phone message that, I just wanted to let you know she cut herself again and I'm very worried? And
I think that really is something that should be negotiated up front at the beginning of treatment. Some providers want to get that information. Other providers are really looking for the patient to bring that information in. But I think it is a terribly important question for parents to ask their treaters. Even if your kid has been in treatment for a while, and you haven't ironed that out, I would go back and say, what should I do about this? If I know that my daughter's cutting, do you want to know about it, or are you going to manage this on your own?
Okay, great. I still have lots of follow-up questions on that, and especially about the parental distress. But I'm going to come back to that, and I want to get through some of our other questions that have already been submitted.
Okay.
So question number 2 that was submitted: why do talented, capable adolescents want to harm themselves? I just find it hard to understand. How can I encourage my granddaughter to express her emotions and share her negative thoughts with other people? I feel or suspect that if she were able to share her negative thoughts, she would be better able to deal with them, and I'm going to insert, and maybe wouldn't cut.
Yeah, I think that's so the problem here is actually in what it means to share. Because in order for us to share our feelings, we actually have to know what they are, and we actually have to be able to tolerate them. That is, to just experience the feelings without moving into action, without trying to make the feelings go away. The majority of people who self-injure are people who are using self-injury as an emotion regulation strategy. So they are people who actually have a great deal of trouble expressing their emotions, either because they can't tolerate them, but also because they don't actually have the ability to accurately label and identify their emotions. They sort of know that they're overwhelmed by something, that they want to escape the sensations and the experience of the emotion and move right into action. I think it is fine actually to encourage your kid to figure out how she can develop the skills to express her emotions and share her thoughts with other people, especially people close to her and her therapists. But the skills deficit around self-injury is, as I said earlier, is just one in which people feel overwhelmed by their emotions, jumping out of their skins, and want to escape from that feeling. And they want to do that quickly, where sharing your thoughts and your feelings takes a little more time to think it through, to figure out how you're going to articulate it. There's also often a fair amount of shame that comes up for these people around their emotional experiencing. And so it's a very complicated thing. I think that what you can tell your granddaughter is that you hope she's working towards this, and you are absolutely confident that she'll be able to sort this through.
Good. So the next question: what's the best way to react if your child begins to cut again after having stopped for an extended period of time?
Well, I think the first thing you need to do is to acknowledge to yourself your own disappointment or anger or worry that shows up, and to begin to work on that a little bit and sort that through. Then, after you've done that, you can then begin to speak to your child about what's changed in their lives, that they had been doing so well without self-injury. What is the kid's hypothesis about what has happened that they're back doing it? And but I think often for parents, when there has been this hiatus and then they notice that their child is self-injuring again, anger and worry show up that often gets in the way of having a more effective conversation. So the first thing really is to manage your own distress about this.
Okay, and I think we're going to come back to this.
All right.
Question number 4. How do I respond when my son tells me he wishes he were dead, or he was thinking about jumping off of a bridge?
Oh my. That's a tough one. And I'm not sure there's just one way to go on this, because since at least it's what I'm inferring from the question is that this is something that shows up with a pretty regular basis. So I think that I would simply try to validate as best you can your son's experience of, that is, what is the nature of his distress, how hard it is to feel like suicide is the only solution that seems effective in the moment, while at the same time very forcibly saying that suicide is not the answer to these kinds of problems, that there are ways that he can sort this through, that you'll be supportive to him, but that absolutely suicide is not the answer. Where sometimes parents go wrong, and as a therapist I've gone down this road too often, then the response is, well, why shouldn't I be dead? I'm suffering. Everybody's going to be better off without me. Those conversations, I think, are pointless, and I would just keep this one short to, I'm terribly sorry that you're suffering, and suicide is not the response to life's problems.
And so let me push you on that, because we've had a couple of other people ask about this, and I think this is a common dilemma for parents, that their child's constantly saying, I wish I were dead, I can't take this life anymore, nothing's going to help, these therapists all suck, that psychiatrist doesn't know what he's doing, he won't give me the right medicine, that maybe there's no medicine for me, I'm just going to be miserable my whole life, I wish I were dead, I wish I were dead, I wish I were dead. And then you're going to say, I'm really sorry, you go ahead and roll, we'll do a little bit of a role play now. So you tell me what you're going to say initially, and then I'm going to react.
So, okay, fair enough. I don't know why I got up to do this anymore. I didn't know it was going to be like this.
Sorry to do this to you so early in the morning.
Yeah, well, so I would say, oh my, something like this, in your own voice. Oh my, it sounds like things are really falling apart for you again. Is there anything I can do to help? And I really think, I'm absolutely convinced that you're killing yourself is absolutely not the right solution to this problem.
Well, I'm not going to do it right now, but I honestly just don't think I can. I don't know how much longer I'm going to. Yeah. I'm not going to make it to 30. There's no way I'm going to be 30 years old. Okay. I can't keep existing like this.
Well, the good news is we have some time, and I hope, and I think we can all work towards this, that your suffering doesn't have to be continuous, that I'm sure we can find some ways that we can get a little moments of joy into your life. I know that must seem totally crazy to you, but I am absolutely convinced that we can do this. And if you'll stay in the game with us and your therapist and your parents, we will absolutely dedicate ourselves to trying to help you figure this out.
Okay, fair enough. I'll let you off the hook with that.
Okay.
So let's take the next question. My son is 40 years old. He keeps telling me that he needs Xanax to feel normal. He threatens suicide whenever there is any stress in his life. He's very controlling, so it's hard for anyone to be with him. I don't know what to do or say to him. Should I set limits with him? If so, what limits do I set, and how do I do that?
This is a multi-layered and very complicated question. Because first I'm back on that he keeps telling me he needs Xanax to feel normal. So the question then becomes in my mind, is your son suffering from significant anxiety? And is he being prescribed Xanax, or is he somehow picking up Xanax on the street? That would be two very different kinds of things. Suicide is often an escape behavior, so it doesn't surprise me that someone who, and I'm guessing here, who is quite anxious and doesn't really feel that they have the wherewithal and the resilience to handle life problems is going to go to suicide as a threat. What's also missing, and maybe we can hear more about this, is what do you do when he threatens suicide? What is your response to that? The question is, in my mind, is are you overly solicitous? Do you, out of your own worry, which of course makes perfect sense, you come in and try to solve some of these problems that are in his life? Or is it that you just, which seems also pretty understandable, just stand there stunned and absolutely speechless? So it's a little bit hard for me to tell you what to say without knowing what you have said to him, so that we can sort of sort through what the effect of your words have had on him. It's also difficult for me to know from the question what you mean by controlling, so it's very hard for anyone to be with him. I don't know if that means he dominates the conversation and won't let anybody offer another perspective, or that he controls people by pushing them away. So I wish if I had more information, I would try to do a better job with this question. And I'm also assuming that this is not a new problem for your son, that he's probably been struggling for many years. but from the question, it's hard to know whether this is a relatively new problem, or, as I suspect, this has been going on for a lot of years.
Okay, so we'll maybe take a pause on this question, and I'll ask if the person who submitted that question is attending the live webinar now, if you could provide maybe a little additional detail in the Q&A box, we might be able to come back to that and go in depth a little more. But let's move on. So the next question is, I'm a 36-year-old woman who has recently been diagnosed with borderline personality disorder. Self-injury or the desperate threat to harm myself comes to me in the blink of an eye, almost out of nowhere, as if an unanticipated freight train has just come up behind me, taken over almost all attempts to cool down. Why do these desperate, surprise, self-injurious ideations almost always involve the man who I'm romantically involved with at that time? And why is this my brain's go-to response to what I sense is disloyalty or possible abandonment?
Oh, what a well thought out and well articulated question. So let's try to break this down. Oftentimes, we're not as mindful of our own emotional experiencing as we need to be. And when we're less mindful, we have the experience of things just showing up out of the blue. But what's really cool about your question is that you know the situations in which these self-injurious ideas and emotions are going to start coming up. And you know that it's often in relationship with your man friend, and it sounds like you have a history of that, and that it often is when you feel the threat of rejection or abandonment. So finding some ways of staying mindful in his presence and noticing how vigilant you are about those things that he does that lead you to believe that you're being abandoned is going to be terribly important to break those behaviors down and that chain of thinking down so you can get on top of this. The other thing to also hold in your mind is that the fact that someone feels abandoned doesn't mean that they're actually being abandoned. And so it may be that you have to tolerate this sense of abandonment, sort it through, and in a sort of effective and reasonable way, try to get some feedback from your man friend. Are you annoyed with me? Are you thinking of leaving me? Now, you can't do that 10,000 times, I got to tell you, because that will kill a relationship. But I think it's around tolerating the feeling and maybe getting some feedback interpersonally that's going to work your way out of this. So start with being mindful and noticing the chain, because that's going to undercut the kind of immediacy of the thoughts coming up. This will take some time. I would absolutely, in your relationship, surface this with your man friend, as in, I got to tell you, when this happens, when you do this, this is what happens for me. I'm not holding you responsible for the way I feel. I just want you to be aware that I get very sensitive about these issues and that I may need a little bit of reassurance in these moments. I will try not to overburden you with reassurance seeking, but are you willing to work with me about this? So that's where I would go with this. Now, are you going to press me on this?
I am definitely going to press you on it. I've got a couple of things that I want to press you on.
Okay.
So let me take the second one, which I think is a little easier and probably quicker. So what if this man friend is really angry with her, and maybe he's not the calmest, coolest, most rational, nicest, Prince Charming on the planet? And so she says, I'm freaking out right now. Are you annoyed with me? And then he yells at her, yes, of course I am. What do you think?
Yeah.
He calls her a name. He's like, you can't do this to me. I can't take this anymore. I can't.
And if that were the situation, I might ask the person who wrote the question, is this the guy you want to be with? Okay, because it may be that you need someone who's a bit more responsive and to your own emotional needs. But if not, then I think what you need to figure out and hold in your mind is, does his being angry actually correlate with his wanting to abandon me? Because we all get angry at people who are close to us, and if we always thought when that person got angry they were leaving me, our lives would be made a mess. So the question is then, can you hold in your mind that when he's angry, it does not mean that he's going to abandon you, and that really all you need to do is figure out how to work through the situation that raised anger in him.
So one question I have on this particular topic, I'm interested in your thoughts about how to concretely do this. Because like this person very clearly articulates, and like so many other patients that I've worked with will say, is that it just happens so fast, there's no way I can get control, like I can't do that in those moments. And so one question that I have is, what are your thoughts about role-playing these types of scenarios, maybe with your therapist, so that it's almost kind of like an exposure type of a therapy, that you actually, maybe in a therapy session, actually really wrap your brain around, he just said something awful to me, he used an awful tone, I'm convinced he's going to abandon me, now I'm starting to really freak out, like even here in this office, he's not even here. He didn't even do any of this stuff, and I'm kind of almost getting freaked out a little just thinking about it. And then work with your therapist on, okay, now that we've got you in that state of mind, what can you practice, what can you do?
Yeah, I think that's a fabulous idea, and I can tell you on 3 East we do this quite regularly as we are helping kids try to figure out these situations. But let's go back to it, that it comes up out of nowhere. Again, I think if you can be more mindful of the relationship in the moment, the notion of things surprising you is going to diminish. Then if you really have this pattern, I would certainly bring it into therapy, saying, I need some help figuring out how to do this. And as Chris was outlining, this kind of discussion really should include role play with the therapist actually enacting the part of the boyfriend here, because it can't be talked through. You really need to have the emotional experience of getting your worry to a certain level and then finding ways to respond effectively to it. This isn't one of those things that you can read about it in a book and then do it. You actually have to have the experience of doing it.
Great. The other thing that I wanted to talk a little bit about is this concept of mindfulness, and for people who aren't very good at being mindful,
which is most everyone,
in moments like this. Yeah. How do you think about helping them get to a state where they can be more mindful? Because again, these are like the big ticket kind of all-out emotional responses, and mindfulness for most people, I think, just seems absolutely, utterly impossible to them when they think about how in the hell can I be mindful when I'm having that reaction? Because I've tried, it just doesn't work, and the emotions just sweep over me, and before I know it, I'm...
Okay. The way around this is that you need to have a regular mindfulness practice, and actually be practicing mindfulness not in situations like this, because this is absolutely the hardest kinds of situations to be mindful, when your emotions start rising rapidly and worry shows up. So you need to practice on a regular basis, and part of the practice needs to be just noticing what you're thinking and feeling, but from a position of what might be called observe and describe. So I'm observing this thought. These are worry thoughts I'm having up. I'm noticing that I want to run away. I notice that I want to strike back. But doing that kind of work when the emotional temperature is lower will make it more likely that you will be able to approximate mindfulness in these highly fraught situations. The other thing that seems to happen is that even though you may lose it in the moment, the recovery time, that is when you get your mind back online, is going to be shorter if you actually have a mindfulness practice.
Okay. And so one question for the parents that I'm anticipating maybe some of them are wondering, should they, if mindfulness is one of the strategies to help people possibly prevent themselves from self-injuring, should parents be encouraging their loved one to be practicing mindfulness on the good days? Because on the good days, it can often seem like, well, everything's good. I don't need to do anything. I'm good today. Everything's fine because my mood is good, and my boyfriend's being nice to me, and my parents are being nice to me, and I don't need to do anything.
Well, here, this is always a double-edged sword, and really it depends on what parents know about their kids. There are some parents who I say, if you want your kid never to practice skills, tell them to practice skills. There are other kids for whom a reminder actually works. So, you need to sort of think that one through. Another possibility is for there to be a mindfulness time in a family, so that rather than, okay, kid, you go practice mindfulness, the whole family spends 5 minutes, 10 minutes in a mindfulness practice. And I think that probably is going to be a more effective way than having parents say, I think it's time for you to practice your skills.
Yeah, no, I actually really like that idea, and it's a way to help parents learn this skill.
Yep.
And as we come back to parental distress, my guess is that mindfulness for parents may also come in handy.
Absolutely. Absolutely.
That I see my daughter cutting herself, I'm getting overwhelmed, I'm about to freak out, I'm about to cry, I'm about to scream at her, I'm about to do something, and maybe I need to take a step back and just...
Right. And the step back is not, I'm no longer worried. The step back is, I notice that I'm worried. How am I going to manage the worry to move the situation forward?
Yeah.
So mindfulness is not going to take away your worry. It's just going to make you more effective in those moments of worry.
Good. So I think we will move on.
Okay.
So our next question, is risky behavior considered to be non-suicidal self-injury? For example, somebody who climbs bridges or jumps from scary heights into water. We've actually got another question, skin picking, things like that. Are those considered self-injury?
By definition, no. The definition of non-suicidal self-injury is the deliberate intent to cause tissue damage without the intention of suicide. So Now, that doesn't mean that climbing on bridges and jumping from scary heights into the water isn't a terribly worrisome behavior, but just in terms of how the more strict definition of non-suicidal self-injury, it doesn't meet that criteria. But I've got to tell you, if my kid were doing that, I'd have just as much worry.
And what are treatment strategies, or what are things that parents need to be thinking about if their child is doing kind of wild, crazy, reckless, risky things?
Well, that's a real tough one, because mostly what you get from kids who are doing this is, I like it. It's a thrill. And there is a fair amount of normative thrill-seeking behavior that goes along with some adolescents, not all adolescents. And because adolescents' brains are not fully developed, and they're not developed in just the wrong way, that is, the judgment center isn't really brought online, it's very difficult for some adolescents to truly assess the risk. And but I think that very clear limits and discussions about this really need to happen. And I really would, if the kid is in therapy, I would absolutely let the therapist know what's going on and see if the therapist can't figure out with the kid, if to the degree that this is thrill-seeking behavior, are there other kinds of behaviors that can bring about thrills that are less dangerous? Like, for example, not that I would ever do this, but bungee jumping from a bridge might get you the same kind of thrill than just jumping into the water, which could get you killed.
Mm-hmm. Okay. So the next question, how do you help an individual who is screaming and yelling at you, I'm going to insert, while they are harming themselves, or just screaming and yelling at nobody, but just screaming and yelling?
While they're self-harming.
While they are self-harming.
Oh, what an awful spot to be in. So it depends on what they're screaming and yelling in some ways. If they're screaming and yelling, why aren't you helping me? That's one thing. If they're screaming and yelling, get the hell out of my room, that's another thing. But I think when someone is as dysregulated as that, you've only got two ways to go. And the first way is riskier, where you say, I can't help you if you're screaming and yelling at me, and I would like to, so stop screaming and yelling. And if you can come across without anger, but with firmness, you might get the person to stop. I'm not all that confident in that intervention, but it is a possibility. The other is to raise this in moments of calmness about what happens for you when the individual, loved one, is screaming and yelling while they're self-harming. What that does for you, how that makes you feel, and then isn't there some way that we can figure out how to get you, most of all, to stop self-harming, and second, to stop screaming and yelling, because people generally can't think things through when they're being screamed at and yelled at.
And how about this scenario, just to cover at least one more base, how about the scenario of just somebody who's yelling and screaming just out of frustration and, I can't take this anymore, I can't take my life, I hate myself, I hate myself, I hate myself, and is cutting.
Yeah.
And it's not directed at you, but you as a parent obviously want to somehow intervene.
Yeah.
The person certainly calling attention, not necessarily on purpose, but is attracting your attention by the screaming and yelling and what they're doing. And
okay, so here's a possibility. If they're screaming and yelling and really emotionally dysregulated, and you can insert yourself into the conversation, you can say that there is something that you know that you can do that will calm them down immediately, and probably, while it may not work quite as well as self-injury, it's going to work pretty quickly. And the skill that you can use here comes from the tip skill in the in the distress tolerance section of the DBT manual. And this is putting something cold around this part of your face. The science behind this is that when the vagus nerve gets cold on it, your respiration slows down and your heart rate slows down. If your heart rate and respiration slow down, that's incompatible with extreme emotional experiencing, and you will just calm down. You don't have to think about anything, you just have to do this. A couple of caveats about this. If you have a kind of heart condition where lowering your heart rate too quickly is a problem, this is not the skill to use. There are other tip skills you could use, like intense physical exercise. But the real trick is seeing if you can't capture the person's attention while they're screaming and yelling and trying them to get to do something different. And so one of the ways that we do that on the unit when this comes up is we forcefully, not in a dysregulated way, ask the person, do you want to stay feeling miserable, or would you like to try something that's liable to help you calm down right now? That is, do you want to stay miserable, or do you want to see what we can do here? And it really only takes a couple times of someone accessing more skillful behavior for them to be more likely to reach for that again and not move to self-harm.
Great. No, that's very helpful. So the next question, can self-harming individuals with borderline personality disorder benefit from therapy that treats self-harm as an addictive behavior?
Well, there is a little bit of evidence that for some people, I think it's a rather small minority of people, where self-injury actually does follow a model of addictive behavior. But it's hard to know from the question what that would look like. Now, where it would follow treating addiction is if you can get the person to move to an abstinence model. That is, I'm shutting the door on self-harm. I am not going to do it regardless of my urges, and that I'm going to get myself involved in other kinds of things when the urges come up, whether that's calling my therapist, calling a hotline, even going to a meeting if you want to follow that model. But what we think we know is that it would have to follow an abstinent model, not a harm reduction model. There's very little evidence that treating self-harm from a harm reduction model actually works. So it would be really, and actually in DBT, this is what we're really doing, is we're actually trying to get someone to make a commitment to take this behavior off the table, which is not the same thing as a promise, but it's a commitment that heart and soul, I'm going to work on this, and that I'm going to access whatever help I need when I'm worried that I'm going to fall off the wagon.
So the next question, my daughter no longer lives with me, and I only speak to her once a week. Is there anything I can do to help her give up self-harming behaviors? Should I ask about it on a regular basis?
Okay. I think there's probably not anything specifically you can do to have her give up her self-harm. I think when you hear about it, I would go back to what I said earlier, which is you really hope she finds a way around this, because the problem with self-harm is that it makes the problem of emotional experiencing go away in the moment, but it actually doesn't solve life problems. So it's a short-term solution to longer-term problems. Now, should I ask about it on a regular basis is more complicated, because that would really depend on your daughter's response to you when you ask about it. And that becomes even more complicated, because if she likes you to ask about it, but it doesn't stop self-harm, then you're being curious and solicitous in those moments may be reinforcing self-injury. So careful about that. And I certainly wouldn't ask just about self-injury, I would, and I suspect you do, I would ask about self-injury in the context of any number of other questions about how life is going.
Would you, knowing that this daughter has at least struggled with self-harm and probably depression and lots of other problems, on a regular basis, would you encourage this person, mother or father, to ask the daughter, like, how are you doing? How are you really doing? Well, I really care about you.
Yes. How you're really doing is a much broader, open-ended question than are you self-injuring? Because sometimes I've had patients who have said to me, all my parents care about is whether I'm self-injuring or not. They don't want to know about the rest of my life. So even though I suspect that that's not actually what parents are asking, you need to be really careful that you're asking broad enough questions so that it isn't just seemingly pointed about your own worry about their self-injury.
Yeah. Yeah, no, well, and I imagine a broader question like that could then lead to the self-injury thing of if she says, I'm not doing well at all, you could follow up with something like, I hope you're figuring out a way to manage that safely, yep. Or I hope you're figuring out a way to manage that. That must be awful for you. Yep. I'm so sorry to hear you're still struggling. I'm sorry to hear you're feeling so awful. If there's something I can do, let me know.
Absolutely. I mean, I think that sometimes as parents, the best we can do is simply validate our kids' suffering and let them know that we know it's happening. We are confident they'll figure this out, and if there's anything we can do, please ask.
Good. So we'll go to the next question. So this is rather lengthy. So you'll have to listen. You probably can't read it from your distance. So my daughter with borderline personality disorder recently turned 18 years old and is between school and university with a routine, or without a routine, and her life is undergoing a number of changes. There are many behavioral issues that make living with her very difficult, but the one I would like some guidance on is not a classic self-harm situation. My daughter will go out and not come home for days. During this time, she's not contactable. She refuses to answer her phone or turns it off. When she was 17, I made every effort to track her down, and that never turned out very well. Now I just stay home and worry. I know she's drinking and getting together with boys she doesn't know. We've had many talks about the risk this puts her at, but I can't get through to her. I feel that kicking her out will make things worse. How should I deal with this as a parent? I don't want her bringing these boys into my home. I don't give her any money because I've told her that getting money is conditional on her helping me with chores around the house, and she refuses to do that. But I worry because I know the lack of money makes it more likely she will steal or go out with boys. My daughter is in weekly dialectical behavior therapy, and we are in week 12 of a 16-week group therapy session. It's helping with understanding, but she's not making much effort to practice the tools, or they're not working.
Yeah, my goodness. I wish I had some really great advice for you. I hope that this behavior of disappearing is something that her therapist is actively taking up with her and targeting, and that the behavior that goes along with this is also being actively targeted. There really isn't a lot you can do here, not because your daughter is 18, but because she does not seem to be either interested in changing her behavior, and maybe because she feels what she's doing is not a problem. And while I suspect that you have been very clear with her what all the problems are, I think that this goes back to the therapist. And what's in my mind about this is that if this were my patient in DBT, I would go back to what her goals are, her life goals, not necessarily her goals for treatment, but what are her life goals, and then to see whether this kind of disappearing behavior and drinking and risky sexual behavior is actually in line with her life goals and her life values. I suspect that that's where you might get some traction. That is, your daughter is free to do this behavior, but the consequences of doing this behavior may in fact be a detriment to her moving her life forward. So I might, if I were supervising the therapist, which of course I'm not, I would say, I think you need to target this disappearing behavior, and you need to see if you can't get some more motivation for the patient to change this behavior, because I suspect the behavior is absolutely not in line with her life goals.
Okay. And one other thing that I would at least want to ask about or raise the question of, when I hear this situation, she talks about possibly alcohol being involved, but I'm almost wondering whether the daughter has an addiction to even maybe a more detrimental substance, like an opiate or cocaine or something, and she's going out and prostituting herself to get those things.
Yes.
And that if she in fact has a serious opioid addiction, for instance,
right,
she may need intensive
absolutely
detox and substance abuse treatment,
yeah,
more than looking at this as necessarily just self-injury.
Yeah, absolutely. That the thought went through my mind too. Although you allude that she does some stealing. Now the problem with stealing is that's usually not a behavior that is going to support one's life goals, unless your goal is to go to jail or to, be court involved. So again, it's around the therapist drawing your daughter's attention to how her behavior is going to impact her life's goals. And I'm assuming that because she's going off to university, that she actually has some longer-term goals. Stealing is one behavior that may prevent her from going to university.
Yeah. Okay. No, thank you very much. So those are the questions that were pre-submitted. We've actually gotten quite a few questions in. So let me give you one. We'll start with one, and we'll get through as many of these as we can. So one person actually submitted a lot of different aspects, but I'm going to give you a bulleted version and a targeted question. So this particular woman discloses to us that she's been diagnosed with borderline personality disorder and Asperger's disorder. Her husband gets irritated with her when he sees that she's cut herself. She does it at least 3 times a week. He read a book about partners with BPD that told him that he has a right to insist that she is taking his life away from him, and so he tells her this, and then he calls her a drama queen. Is there a better way? Is there a way for her? She actually says, is there a way to reach out to someone who doesn't seem to be concerned about me? So she's assuming that his response is indicative of a lack of concern for her.
Mm-hmm.
So, but I'm going to ask you maybe to comment on that, but more generically, any suggestions or recommendations for how she, or somebody else who's cutting and just feels misunderstood, whose parents are yelling at them, or whose boyfriend or husband is yelling at them, or saying you're a drama queen, you just want attention, stop it. Any recommendations for the people who are self-injuring? What should they say?
Okay. Well, calling someone a drama queen, let me just say, never works. So you ought to tell your husband to try something else. That isn't going to do this. But the question in my mind is, do you want to stop self-injuring? And if you do want to stop self-injuring, I think you need to let your husband know that that's really a goal of yours, that it is really difficult for you to get on top of this behavior, but you're really working on it, and that while he may not fully appreciate that, you can assure him that you really want this to stop. Now, if it turns out that you're someone who doesn't want this to stop, then I think that his response is, without the drama queen, is something that you're going to have to contend with, because it may feel to him that the self-injury is getting in the way of being more intimate and having a better relationship, and that's going to have to get sorted out. but I'm going to assume that you really want to stop, and that he probably needs some more education about this. I think it's important for partners to insert themselves into the self-injury, as in this does have an impact on me and have an impact on the relationship. But I'm not sure that then going to you're a drama queen, which essentially is judgmental and says you really could do better, you just really like all the negative attention you're getting from this, cut it out, which simplifies the problem and also is a real misunderstanding of the problem.
Okay. Another question that we've got is, will these urges to cut and maybe other issues, this person references eating disordered issues particularly, but other issues, will they just go away with maturing, with age? And can that be helpful to share with our teens, or will that actually seem invalidating or increase defensiveness?
I think it'll be seen, I'll answer that one going backwards. I think it'll be seen invalidating to say you'll outgrow this. And there is some truth that they may outgrow this. So I think that's something that parents can keep in their back pocket as a reassurance for them. But there was more to the question. Was there something else in there?
No, will the cutting urge and eating issues go away with maturing, and should we talk about this, or will it increase defensiveness?
Yeah.
So,
yeah, I think it'll increase defensiveness. And it will also go away as your kid gets more skill sets, which I'm hoping they're getting in treatment, to manage the urges. If they don't act on the urges will eventually go away, or at least greatly diminish. We keep urges around by giving into them. That's how, if you want an urge to stick around, just give into it, and it'll keep showing up.
Great. So we've only got a few minutes left, so I'd like to come back to this topic of parental or caregiver self-care. So you've given us some really good examples of things that a parent or a caregiver or a loved one or somebody might say to somebody when they're actually cutting, or when you find out that they've cut. And your overall recommendation was keep it fairly short and simple, and that, validate that I'm sorry you were so overwhelmed and distressed, and I'm sorry you couldn't come up with another solution or a way to manage that, and I hope that you'll be able to find a better way to manage in the future. But then the parent walks away from that and probably is about to burst into tears, or probably about to scream, or goes to their spouse and is yelling and screaming, I can't take this anymore, what am I supposed to do, I love her so much and she's doing this and I can't take it.
Okay, so I think two things. There's the short-term way of solving this problem, and then the long-term. One of the things that we found to be a regular behavior for parents of the kids in the program is they stop doing all the things in life that brought them satisfaction. So they drop the book club, they drop the gym, they drop going out to dinner, and they just are staying home. And our advice to them has been, well, do that for a couple of weeks, and if it changes self-injury, you've got a solution. If it doesn't change self-injury, go back out, because you have to nourish yourself throughout this rather difficult period of time, just to have the emotional energy to stay in the game. So parents, don't give things up. Keep the things that are nourishing you in your life as best you can. Even though in your heart of hearts you probably don't want to go out, you don't want to talk to anybody, you want to be alone, I would encourage you to act opposite. In those moments where you're right in the heat of the battle, and then you need to decompress, there are any number of things that you can do. You can get yourself really involved in an activity. You can, and these aren't, I always are asking people to, when they're thinking about skills, to do a series of skills, not just one skill. So it might be that the first thing you want to do is call a friend and just vent, and then move into an activity, go to the gym, listen to some music, do something to soothe yourself, because you're going to be needed in the long haul, and you're going to need to stay in emotional shape. So decompress. It would be perfectly understandable that you're going to be worried. I think you can acknowledge your worry. I think it's also useful sometimes to radically accept that there's not much you can do right in this moment, and that you're playing for the long haul, and that this is just one moment in time and does not actually predict the future. So sometimes what we've seen with parents is that their minds go to, well, if this keeps happening, then she's not going to be able to go to college, and if she doesn't go to college, then she'll never get a good job, and if she doesn't get a good job, she's going to wind up homeless, and da-da-da-da. And the idea is to sort of notice you're having those thoughts, and then just bring yourself back to what you can do right now.
Great. No, I think that's very helpful, and we'll have to end on that note.
Okay.
So thank you so much, Dr. Hollander. This was a great presentation.
Thank you.